virtual and remote meeting organized by the World Bank. From waste to action, wastewater as a lens to control COVID-19. Today, with us, we have a high-level panel to introduce and to discuss the main findings of the new study by the World Bank on the benefits and challenges of the use of wastewaters to control COVID-19 and other threats for public health in Latin America and the Caribbean. I'm Josefina Townsend. I'm a Peruvian journalist, and I will be joining you in this meeting, which is being transmitted as a webinar via Zoom, via YouTube, and you can also follow us with hashtag from waste to action. Also the World Bank Twitter account, which is at World Bank LAC. So this is being also transmitted in Spanish and English. You can choose a language of choice with that world icon you could see in the lower part of your screens. In the YouTube World Bank channel, you can also find the versions in both languages. We'll start then this session with Carlos Felipe Jaramillo, who is the World Bank Vice President for Latin America and the Caribbean. Carlos Felipe, good afternoon. Go ahead, please. You can take the floor. Good afternoon, Josefina. And he's saying it now in English.
Of policymakers and experts to this event, and thank you very much for joining. The context and urgency for our discussion today is obvious. No? Latin America and the Caribbean has borne a huge burden through this pandemic. And we know that this current Omicron variant is spreading like wildfire through our region. Since the pandemic began, the region has suffered more than 50 million infections and sadly more than 1.5 million deaths. This only accounts for part of the disastrous toll that COVID-19 has had on our region. The impact on educational outcomes, on jobs and incomes has been massive, and disproportionately it has affected the poorest and the most vulnerable, especially women. With its unrelenting social and economic consequences, COVID-19 threatens to undo hard-won gains in development outcomes in Latin America and the Caribbean. In the face of this unprecedented crisis, the World Bank Group has mounted a historic response. Since April of 2020, we have committed over $157 billion to fight the impact of the pandemic, and we have made available $20 billion to help developing countries finance the purchase and distribution of vaccines. For example, in Colombia, I'm proud to say we have financed the vaccination of over 1 million migrants, mainly from Venezuela, that are living in the country. So it has been very encouraging to see the vaccination progress in the region, with most countries reaching the goal of vaccinating fully 40% of their population, and they're on track to reach 70%. However, it is clear that more needs to be done to better prepare the countries to respond to the current and future pandemics. So today, we are focusing our conversation on an innovative approach, an approach that I believe is important, it's timely, and should be scaled up across the region. In brief, it is about using the existing sewage networks for public health surveillance purposes. If COVID-19 has taught us something, it is that to address complex problems, we must look at ways to do things differently and to learn from one another. Wastewater-based epidemiology, which is what we're going to talk about today, has actually proven extremely useful in high-income countries, particularly when clinical testing is too expensive or it's overwhelmed or it's insufficient. And this can be a very efficient approach, and it can be deployed relatively cheaply in our region. It could be a key instrument for a more targeted, efficient, and rapid public health response when countries will be confronted with other public health crises and health shocks. We at the World Bank are ready to support countries across the region to implement innovative solutions that work at scale. With today's event and the report we are launching, we hope to spark an important conversation on wastewater-based epidemiology and to catalyze its adoption across the continent. This conversation has happened mostly in high-income countries so far. We hope to change that today and spread it to middle-income countries and low-income countries. We are already providing technical assistance in places like Ecuador and Argentina, and engaging in several other countries in the region. We see countries such as Ecuador, Peru, Mexico, Uruguay, and Argentina engaging on this issue, and we will mobilize our financing and our technical expertise to help countries that are ready to deploy this innovative solution to be better prepared to respond and mitigate the negative impacts of this pandemic and for health crisis in the future. Many thanks. Back to you, Josefina.
Muchas gracias a ti, Carlos Felipe.
Thank you, Carlos Felipe. We have a video to show how wastewaters are used to control COVID-19. Let's go to the video.
Uno de los mayores desafíos de la pandemia de COVID-19 es el monitoreo de la propagación de la enfermedad. La identificación temprana de brotes y olas es clave para controlar el COVID-19. Una forma menos convencional de rastrear la propagación de la enfermedad es mirar debajo de nuestros pies, en nuestra red de alcantarillado. ¿Cómo funciona esto? María se ha desgraciadamente contagiado con el coronavirus. Cada vez que usa el baño, el virus que está presente en las heces se transfiere a las aguas residuales. Como María, otros se han contagiado y, sin saberlo, están esparciendo fragmentos del virus por el sistema de alcantarillado. Ahora Juan, quien trabaja en los servicios de agua y saneamiento de la ciudad, recolecta una muestra de aguas residuales. Sofía la analiza y puede determinar la concentración del virus. Interpretando los resultados, ella puede estimar el alcance de la enfermedad en la población que usa el sistema de alcantarillado. Esta línea de investigación se denomina epidemiología basada en aguas residuales, o WBE por sus siglas en inglés. Una tecnología demostrada que brinda información en tiempo real sobre la salud de una población. En el caso de COVID-19, la epidemiología basada en aguas residuales ofrece una solución escalable y práctica que puede informar a las autoridades sanitarias sobre la propagación del virus y a una fracción del costo de las pruebas clínicas. Esto permite que WBE se convierta en un aliado en la gestión de crisis y sea un complemento eficaz del monitoreo del virus. El nuevo informe del Banco Mundial, titulado Refuerzo de la vigilancia de la salud pública mediante el análisis de las aguas residuales, muestra que tanto los países de ingresos altos como los países de ingresos bajos y medios pueden beneficiarse del uso de WBE. Obtenga más información sobre esta iniciativa y cómo el Banco Mundial está apoyando a los países a abordar la crisis del COVID-19 de una manera más eficaz en www.worldbank.org.
I'm sorry, her mic is muted. Excuse us, she's still muted. Next speaker.
Am I ready to go?
I was muted. Escuchemos ahora para conocer lo que decía era que para conocer
So what I was saying is to know a little more about the main findings about this report we are presenting today. Let's listen now to Professor Douglas Manuel from the Ottawa University. Can you hear me now, Professor? You can take the floor.
I'm going to be introducing the report, the key findings from the report for you to start the panel discussion off. The report is about wastewater testing, not only for the COVID pandemic, but also for future health as well. Many of you may not know about wastewater surveillance. That's completely understandable. As the video described, it's really a hidden out of sight, and the development has not been in the headlines in Latin America and Caribbean. So today is our day to start talking about it for those who haven't seen it before. For those who know it, it's becoming a really valuable and indispensable tool for those who are using it or have begun to use it. And I will discuss those. The bottom line is wastewater testing is filling surveillance gaps, and it is affordable. The authors of the report felt it was timely for member states to carefully assess still increasing. The restaurants are closed, hospitals past capacity, PCR testing has exceeded capacity, and surveillance based on PCR testing is unable to provide a trajectory of where the Omicron wave is going. Still, the premier of the province has announced a few days ago that the province will begin opening in 2 weeks. How is that possible? Wastewater testing is showing that SARS-CoV-2 is decreasing in Ontario. It probably began decreasing around 2 weeks ago, despite hospitalizations and ICUs still increasing. The program began over a year ago and cost 60 cents US per person for the first year. So for a population of 14.5 million, it cost less than 10 million US dollars. That information is critical to the decision to open. So can you imagine the return on investment that Ontario is achieving from this? It's an affordable system that can be used in countries throughout Latin America. So there's over 3,000 sites worldwide. You can see this band through low and middle income countries where the testing is not performed frequently. You've heard how it works. Two key points. The method of testing in wastewater is the same PCR method that's done in clinical testing. A strength of this testing is it can detect minute levels of the virus. That means that we can detect a few cases in a population, even though the wastewater is diluted dramatically. Estimates range, depending upon the setting, between 1 case and 50 cases per 100,000 people. The testing can be performed in any place the water is. This is important because in Latin America, there is often not the entire population is on formal or well-developed wastewater treatment systems like there are in high-income countries. However, it can be used in lagoons, trenches, and other settings in low-income neighborhoods or other settings where there may not be a well-developed sewer system. Let's take a moment to think about why we are in this trouble with COVID. It is a challenging pandemic. It is difficult to detect COVID. Many people are asymptomatic. Many people die. There's a huge range in severity. It's difficult to diagnose. PCR testing is expensive even for any country. Rapid antigen testing is less expensive, but still resource intensive and misses many asymptomatic people. It's difficult to control. Spread happens in asymptomatic people and before people are diagnosed. And inequities have been running throughout the pandemic and will continue. If we map wastewater has benefits for each one of those challenges that is driving the pandemic. It can detect people who are asymptomatic. People excrete the virus when they don't have symptoms. It is affordable. One test can give you a snapshot of what's happening in an entire population. That population could be thousands, tens of thousands, hundreds of thousands, or even 1 million people. One test. It supports early detection and control. Again, because it's identifying people who are asymptomatic, it can identify waves early in many situations, and it supports equity. It's a population-based system. It can include everyone, whether they're tested or not. I'm going to briefly go over 4 uses that are being used worldwide. One is early detection. As I said, asymptomatic spread, and it can detect, it certainly precedes hospitalization, and in many situations, it's preceded clinical identification as well. Population-wide surveillance. Clinical testing is difficult to achieve population-wide surveillance. Wastewater is the strength of wastewater. Specific populations. The earliest uses were often in university campuses where it has been demonstrated to interrupt transmission. It can be used in Ontario, it's used in prisons, long-term care, and many other disadvantaged neighborhoods and many other specific populations that are difficult to have good surveillance information. And variants of concern. One, it's difficult to perform sequencing programs, especially on the population level. And imagine if we had wastewater surveillance throughout the world, could we have identified Omicron earlier? Now, you might be saying, Omicron's going to be over and we've missed the boat on this. That's not true. I think we're seeing the beginning of the uses of wastewater testing or more widespread use of wastewater testing. There are 40 biologic infections that can be identified in wastewater. Around the world, people are rapidly working on influenza and RSV, knowing that these infections, along with Omicron or along with COVID, are going to be challenging in the years ahead. It's really a window into the health of the community, and not only humans, but animals and environmental health. It's not a panacea, and I don't want to. I feel like I'm discussing the strengths, but it won't solve all the solutions. There are challenges. It's a new program. Here are the 3 major challenges that investigators have talked about around the world. The first one is scientific, about measurement. To be honest, I am least worried about this challenge. Yes, there are many measurement challenges and scientific challenges. They are being worked on aggressively around the world. I'm more concerned about the latter 2. These are human challenges. Around the world, it's difficult to form collaborations and successful programs because it's a multidisciplinary program. A lot of the programs began as pilot projects and they need to have sustainable infrastructure. It's low cost, but it falls between the gaps for funding. Sometimes people don't know whose responsibility it is, and you have to get all the parties together. From a systems perspective, it's affordable and cost return, but the costs are often spread across the system. Multidisciplinary approach. So this is probably the most key. You will not have a successful program unless you can have the different players involved in this environmental surveillance system working well together. Public health staff are overwhelmed right now. And if they do not have good collaborations with the municipal wastewater systems or environmental testing laboratories, it will be difficult to develop those collaborations during the pandemic. So everyone must develop these close collaborations, and it's been a struggle for all countries around the world. The most successful jurisdictions are ones that have been able to develop this approach. How can the World Bank help? We'll be hearing about that more. The 2 main areas: mobilize finance and knowledge. And you've already heard about that, and what we're doing today, making resources available, building capacity, and convene actors, coordinate, advocate. These can come together into pilot programs or adopting new, wider strategies. The report goes into quite a lot of detail in a pragmatic way about how you can start the discussion in your countries. I won't go over it, but these 4 steps are typical steps for developing a new surveillance program, and we've talked about these steps for wastewater. I'm going to leave with a few questions for you. What are the most important science advances that will emerge from the pandemic? And what surveillance approach has the highest return on investment? Here are my answers. Yes, we will all agree on mRNA vaccines. For me as a science, it's been really rewarding to see open science flourish. I believe wastewater-based epidemiology will be one of the most important science advances coming from the pandemic. What surveillance approach has the highest return on investment? Wastewater. If we surveil all of the world's cities over a population of 1 million, that will cost about $15 million per year. That's 2 tests per week. So $15 million per year covering a population of 1.8 billion. It's hard to imagine the return on investment for this. And finally, I'd like to thank the authors and others, including the Korean World Bank Partnership and the Global Water and Security Sanitation Partnership. As a collaborator with World Bank, it's been a real pleasure to work with the other authors. Thanks very much.
Gracias, muchas gracias a usted.
Thank you very much. Thank you, Professor Douglas Manuel, for this great presentation. Let me now leave you with Michele Granolati. He's the Manager of Health Practices, Nutrition, and Population of the World Bank, who will lead this conversation with our panel of leaders and experts. Michele, go ahead. Good afternoon, Josefina. Good afternoon, everyone.
Health sector, the water sector, the private sector, and foundations and philanthropy with a long trajectory of support to public health in Latin America. And it's a panel with different perspectives and experiences, and they will help us answer some of the challenges that countries are facing, including those of coordination that Douglas just mentioned. The first panelist is Dr. Jimena Garzón Villalba, who is currently the Minister of Health of Ecuador. She's a medical doctor and holds a PhD in public health with a concentration in occupational health and a postdoctoral degree in occupational health and research epidemiology, both from the University of South Florida. Before her role as a minister, she held a very high-level technical teaching and research positions in the General Hospital South Quito. The second panelist is Dr. Rick Bright, Chief Executive Officer of the Pandemic Prevention Institute and Senior Vice President at the Rockefeller Foundation. Dr. Bright leads the development of the Rockefeller Foundation's Pandemic Data and Action Platform to help prevent future pandemics by identifying and responding to the earliest alerts of a disease outbreak and stopping it in the first 100 days. He has extensive experience in global public health, working with the US CDC, PATH, and the private sector, and he has contributed to key advancements in vaccine and therapeutic developments for influenza viruses with pandemic potential and new vaccine treatment and testing technologies. All this is, of course, very relevant for this discussion. The third panelist is Dr. Mariana Matos, the Chief Executive Officer at BioBot Analytics, Inc. Dr. Matos is a Mexican biologist and co-founder of BioBot Analytics, Inc., a startup that aims to help governments tackle the COVID-19 pandemic by analyzing sewage samples. Dr. Matos is a computational biologist, and she's passionate about leveraging big data and analytics to improve human health. As a co-founder of BioBot Analytics, Inc., she aims to build a wastewater epidemiology platform that maps human health in every city in the world. And finally, the fourth panelist is Dr. Humberto Marengo Mogollón, the Technical General Subdirector of the National Water Commission of Mexico. Dr. Marengo Mogollón is a civil engineer and he holds a master's and doctorate degrees in engineering from the Universidad Nacional Autónoma de México, where he has been professor since 1985. He has worked for Mexico's Federal Electricity Commission particularly on dam and hydroelectric plant projects, and as Mexican Commissioner of the International Boundary and Water Commission between Mexico and the United States, among other responsibilities. Welcome. I am now going to ask one first question to each of the panelists, and after that, I will ask a second round of questions. And for sake of managing time, it would be great if you could please keep your answers to 2-3 minutes. I'm going to start with Minister Garzón Villalba. After the successful implementation of the wastewater-based epidemiology pilot in Guayaquil, one of the first in the regions to handle COVID, how do you see the evolution of WBE as a surveillance tool in Ecuador? How does it fit in the public health surveillance toolkit of your country in the context of limited capacities for clinical testing?
Well, thank you very much, Michelle, for your question. There are several well-documented experiences of testing for SARS-CoV-2 circulation, both in untreated wastewater and rivers in Ecuador. The successful implementation of the wastewater-based epidemiology pilot in Guayaquil is one of them, and that's valuable evidence of the strategy's feasibility. As Ministry of Health, we are well aware that the measurement of SARS-CoV-2 RNA in untreated wastewater and rivers can be applied as a reliable, low-cost estimator of changes in the number of cases of COVID-19 at community level. Besides its low-cost and direct estimates from wastewater surveillance, include all the infected people in a population and not just the symptomatics. Therefore, it is an important way to prove early signs of changes in the trend of an epidemic.
Thank you very much, Minister Garzón Villalba. The second question is for Subdirector Marengo in Mexico. Given Conagua's experience through pilots and collaborations with the health sector in Mexico, how do you see the capacity of the water sector to incorporate wastewater-based epidemiology in its toolkit? And here we go indeed into challenges of collaboration. Please. I cannot hear. Here we go. Thank you very much. We cannot hear you, Dr. Marengo. Why I hear maybe now. We cannot hear you yet. While we try to fix the problem, why don't we move to the next panelist and we'll go to Dr. Matos. Please, what do you think could be the role of private sector in scaling up WB in the Latin American Caribbean region? And perhaps you could tell us about your experience of working with the CDC in the US to scale up WB nationwide, and what lessons learned you think might apply to the LAC region.
Absolutely. I think there are at least two possible ways for the private sector to support WBE programs in new countries and regions in Latin America. The first one is to rapidly set up nationwide wastewater programs. So similar to what we did for the CDC in the US, we can quickly go in and in less than a month, we set up a nationwide network that included over 300 wastewater treatment facilities across every state in the US and several US territories. All of those treatment plants covered or represented about 30% of the US population. And we set up this program in less than 1 month, going to get the buy-in from each individual community and then getting their data reported up to the CDC twice per week in a timely fashion. So that's one way in which we can help. We can come in very quickly to set up a nationwide infrastructure to just get things started. And besides getting the treatment plants on board, we have the laboratory methods and expertise to set up that capacity, either in-house or through partnerships.
Lali.
The second way in which we can get involved and how we supported, the World Bank so far, is through lending our expertise and to help to continue innovating. Wastewater is a platform. It's very helpful when it comes to COVID-19 and monitoring the levels of the SARS-CoV-2 virus, but it's a platform that lends itself to become one of the new central pillars of public health. And we can really help drive that innovation, to make sure that other assays are applied on the wastewater to look at other types of interesting data like influenza, or looking at the variants through other assays. And I think that's going to be a very important contribution to make sure that we can make the most out of this new infrastructure and investment.
Thank you very much. Dr. Marengo, we go back to you. And again, if you can please share with us CONAGUA's experience in developing pilot and what has been your experience in putting in place this collaboration between the health sector and the water sector to incorporate the WB as one of the national toolkit for surveillance. Over to you.
Muchas gracias. Muy buenos días.
Thank you very much. You can hear me, right? Okay. Very good.
En sí, la Comisión Nacional del Agua
The National Water Commission has a national network for measurement of the water quality. This network is called REDNAMECA. It's operating since 2012. And through this network, samples are taken from the main bodies of water of the country. This network has to do with the public measurement of data, and this data is provided to the authorities. And of course, the different sectors, environment, health, scientific, and education sectors have reliable data that can be used in a timely manner to make decisions and manage certain resources. Regarding the pandemic, the COVID-19 pandemic, CONAGUA participated together with the National Public Health Institute in a study, the purpose of which was to monitor the advance or the progression of the pandemic of COVID-19 by analyzing SARS-CoV-2 in samples of raw wastewater from 10 treatment plants and their effluents. And in this way, also with 5 hospitals that were chosen to care for patients with COVID-19 at a national level. So 340 samples were taken during a period between October and November of 2020. And the main results that were obtained showed a correlation between the trends regarding time with the virus in wastewaters with the active cases reported by clinical surveillance in the same period of time. We observed different behaviors in the pandemic dynamics. This was applied in several cities, Mexico, Jalisco, Guanajuato, Baja California, and with the peaks and in the measurement of the virus in wastewater, we observed this some days before the increase in active cases, particularly in the state of Quintana Roo and Morelos. Both the measurements of ARN of SARS-CoV-2 in wastewater, both that and active cases that were reported remained within a certain range during the sampling period. Therefore, considering the findings of this study, it has been proven that it is feasible to identify and quantify the ARN of SARS-CoV-2 in wastewater, and that monitoring of wastewater can be used as an additional tool for surveillance of the COVID-19 pandemic. This information can also be used as a reference to quantify the population. And finally, I would like to mention certain considerations which I believe should be taken into account. Firstly, have financing, of course, funding, and that's why we require resources for good financing and to maintain the system, and also to invest in personnel training, and also increase the capacity of analysis of samples and the use of adequate methods for the quantification of the virus that is of interest in wastewater. I insist on the absolute need to have good logistics with the necessary resources and have the adequate criteria for sample taking, and establish a close collaboration and coordination with the health sector and the water sector in order to have the information that will have to be interpreted by qualified personnel, and for this to be communicated in an efficient and effective manner.
Institute at the Rockefeller Foundation. We would like to hear from you how important is WBE in the range of solutions that you are working on to prevent future pandemics.
Well, thank you for that question. We think it's very important. We think that wastewater-based testing and wastewater-based epidemiology is the future, actually. We know from this pandemic and from previous outbreaks that traditional clinical-based surveillance systems are not fully adequate to detect those early signs of an outbreak. What the COVID-19 pandemic taught us, made it strikingly clear, is that our global public health surveillance system is highly reactive. And by the time that we find one of these pathogens or a new variant is detected, it's already too late to contain it from spreading. So there are many tools and technologies that enhance pandemic preparedness, but I think wastewater testing is one of those that empowers us to see and respond to a threat before it's already widespread. Even when there's other data sources, when those other data sources aren't available, wastewater testing can provide essential insights. We have partners that we're working with in Ghana, for example, who are deploying wastewater-based epidemiology in the rural communities where they have no recorded cases yet of SARS-CoV-2. But this doesn't mean that SARS-CoV-2 hasn't infiltrated the region. They just don't have access to clinical diagnostics in that region. So by implementing wastewater testing, the health leaders can detect the presence of SARS-CoV-2, they can monitor the trends over time, and they have the data they need to support their request for resources and other mitigation measures. It's possible even to sequence virus from wastewater-based testing to be able to detect new variants over time in a community. And lastly, I think it was already mentioned very nicely, wastewater-based testing is scalable, it's a cost-effective, it's a low-cost solution, but public-private partnerships are going to be essential to ensure that countries are equipped to quickly stand up wastewater testing programs. And the Pandemic Prevention Institute at Rockefeller Foundation is playing a central role in making that happen because we believe this is so important.
Thank you very much for sharing such exciting news. We go to the next round of questions, and please let's try to be brief as we are running a little bit behind the schedule. And Minister Garçon-Villalba, the issue of innovation has been mentioned already a few times, and we know it's challenging and change is hard. From your perspective as the Minister of Health, how do you think it would be possible to incentivize, to facilitate, to motivate, inspire the public health officials to collaborate further or as much as possible with the water sector?
Well, that is a very important question. Thank you very much. First of all, is to have the goodwill to collaborate with actions based in research, evidence, which is a core value of our government. From our experience, the wastewater surveillance pilots require collaborative work between local universities. Here in Ecuador, like for example, ESPOL, UTE, that's another university, also UDLA, is very important. Also the collaboration of city councils and the important support, the basic support from the central government and also the private partners. Additionally, the generation of evidence-based public policies, for example, and the generation of documentation of successful experiences are essential to strengthen the collaboration between, the government and also universities. Finally, developing ecosystems which foster innovation are also necessary. For example, simplifying requirements for public-private partnerships and lessening bureaucracy is also very, very important. So that's it.
Thank you. Thank you very, very much. And Subdirector Marengo, I go back to you after your very interesting first reply about the experiences, the successes and the logistical financial challenges of setting up these pilots in Mexico. Based on that, what do you think would be the potential and benefits for the use of this tool in the future of Mexico, beyond the COVID-19 pandemic?
Muchas gracias.
Thank you so much, Michele. I believe that the potential benefit is great advantage for decision making. In other words, environmental surveillance will enable us to analyze and also to bring benefits to the society at large, which will be of paramount importance because wastewater-based epidemiology as a tool enables us to anticipate, to predict, to know whether there is a peak coming, whether there is an increase in terms of the disease. We could be detecting early on, and this is the great potential benefit of this methodology. I believe that we need joint actions, government and academia, or the society as a whole, to double the efforts and offer them as a benefit, transcendental benefit to our societies.
Public-private partnerships, collaborations are indeed key for innovation. You mentioned that yourself in your earlier question. So what do you think that the public sector could do, should do, to set up an environment that is conducive for an optimal participation of the private sector in scaling up WB in Latin America and the Caribbean region?
I think that it all starts from a place of raising awareness for this new science and this new technology across levels of government and across agencies. As has already been mentioned before, wastewater-based epidemiology requires the active participation and collaboration from agencies that don't usually work together, like the water sector, the health sector, as well as executive offices, together with like external supporters. And I think that, be able to understand that's needed, and the ecosystem of stakeholders that are needed to implement a program that is successful is very, very important. Second from that, I think other people have already mentioned this, but and I completely agree, is really changing the perspective on wastewater epidemiology and thinking about it as a long-term infrastructure building project and not just as a short-term solution to COVID-19. So fully realizing the potential of it to become a central pillar of public health to help us navigate COVID-19, but even more importantly, to help us prevent the next pandemic. And I think in order to really fully learn from this moment in time, the opportunity that we have is to really change our perspective on WBE and really begin to think about it as a long-term project and long-term infrastructure being built around the world. And I think that would really facilitate the creation of opportunities, which pieces of it does government want to do in-house, which pieces of it do they want external partners, either universities or private companies and vendors, but to really fully enable that ecosystem. I think like it begins from a place of fully recognizing the potential of it and believing in that vision for how it can help us now, but also in the future.
Thank you very, very much. Dr. Bright, we have heard a lot of enthusiasm about WBE, the use, the development, the use of WBE from members in the panel representing the public health sector, the water sector, the private and academic sector. In your role of the CEO of the Pandemic Prevention at the Rockefeller Foundation and brokering some of these partnerships, what advice would you give to them?
That's a really good question. I think one of the most important things that we have to think about is to ensure that the data derived from wastewater-based epidemiology, the data needs to get to those who use it for decision-making. So we know from our work in the United States that a lot of valuable wastewater surveillance data does just end up sitting in dashboards or on someone's computer. And we need to translate that data into action. So collaboration, as has been mentioned, is key across many sectors. Wastewater testing relies on people working from utilities and public health and labs in both the public and private sectors. Everyone speaks a different technical language and has a unique objective in what they do. So we need to invest in these partnerships early so we can build trust and a common language. So when we have that opportunity to detect this new threat and a new threat arises, working together is second nature and natural for the different sectors. And it's also important not to forget about the communities you serve. I mean, most people don't know that they shed virus when they go to the bathroom. So when they hear that someone might be sampling their sewage and looking for pathogens in it, it can be frightening, actually. So when our partners started doing wastewater testing in the rural community, people became concerned that they should boil their water, for example, since they were told that the virus is in the wastewater. So community education, especially at the start of a new technology, is key to success for wastewater testing. Misinformation is often bred from a lack of education. So we want to work to protect wastewater testing from becoming that next target for misinformation by starting up front with education as well.
Well, thank you very much. I am afraid we have to stop here. There are so many more questions that we would like to ask, and more than that, hear from you more. There will be other opportunities. We look forward to that. Thank you very much again for your insight and availability to be with us. And Josefina, I pass the word to you. Over.
Thank you so much, Michele and distinguished panelists. Now we have Jennifer Sarah, who is in the global water of the World Bank. So she will take the floor.
140 people join this conversation. Usually when we talk about sanitation, we say it's out of sight and out of mind for most people. So I really want to congratulate the presenters and the panelists for the excellent presentation. And really what we heard today is an excellent example of collaboration, much, much needed collaboration as COVID-19 continues to evolve into a major public health and social and economic crisis, not just in Latin America, but across the globe. And we know that such multifaceted crises really require an arsenal of innovative tools and approaches. And what we learned today is that we really need to work together across so many sectors in academia, private sector, public sector, ministries of finance, to break down the barriers and to create these innovative solutions. And in fact, I was very struck by the presentation by Douglas Manuel when he talked about the successful implementation of wastewater-based epidemiology and how you really need to leverage working with the public sector, the public health authorities, and the wastewater, the people who are down working on wastewater treatment and in the labs. But also, I was really struck by how important it is to have the Ministry of Finance or those who make decisions, such important decisions about reopening an economy. That's fundamental. So I think bringing this important innovation in the work and detection and having it influence very, very important decisions of a country about if you open an economy or not, I think is fundamental. I do want to recognize what I will call the unspoken heroes of a lot of this work. And these are the utilities, the wastewater, the water and wastewater utilities. Again, out of sight, out of mind. They've done a tremendous job under huge amounts of stress during this COVID crisis. Utilities are usually operating under shoestring, very financially precarious. They cannot disconnect customers for non-payment. And we're asking them on top of this to innovate and to use wastewater-based epidemiology to test out and go in and sample and really looking at the very end of the sanitation chain at the wastewater treatment plant, but also taking samples from buildings, from the sewers, and collecting the data and doing this additional work on standardization of data and reporting and coordinating with the health authorities. So again, it's really important to be focused on also the utilities and the waste sanitation service providers, because they themselves can contribute quite a bit in the innovation. And the fact that they start looking at wastewater-based epidemiology and the huge, tremendous benefits it can have, it also can allow them to bring innovation to other ways that they can deliver sanitation services. And that's my final point, and it's linked to inclusion. Let us recall in Latin America that only 50% of the wastewater is actually collected through pipe networks and treated, and not all of it is treated. And that's good news for the 300 million people whose sanitation, who go to the toilet and we can find out if they have COVID through the wastewater collection and the WBE, epidemiology and surveillance. At the same time, let's remember 50% of people do not have, are not connected to sewers. And so that's also important from a public health perspective. And when we have a pandemic such as COVID, how do we keep on making sure that everyone has some access to a sanitation solution, be it sewered or non-sewered? And I think that's what's the next step of this collaboration, is not only sharing the lessons from Latin America to other countries where we work, but also to keep on thinking of how do we innovate and how we can look at non-sewered sanitation solutions and apply the same type of epidemiology so that we can also have upstream knowledge of where COVID is spreading, especially in the poorest communities in the low-income countries. So again, let me thank everyone. I'm delighted to be here and to continue to work with our health sector colleagues at the bank on this work.
Jennifer, muchas gracias.
Thank you, Jennifer. And in closing, a summary of what was said here, let's now listen to Juan Pablo Uribe. He is the director of the Global Practice of Health, Nutrition, and Population and the Global Facility, Funding Facility of the World Bank. Juan Pablo, you can take the floor. Good afternoon, and thank you so much. I feel at home, really, and it's a privilege having invited me to close this. This is so stimulating, this session.
Been extremely well behaved and disciplined, and have contributed enormously to all of us being able to understand this innovation and the value it can bring to our countries. It's very nice to see that there are already countries in the region leading with this alternative, and that others, as we saw as well in the panel, are already considering to follow. This good example in the neighborhood will, of course, create a momentum for scaling up such an effective intervention. I wanted to highlight, as Carlos Felipe said at the beginning, the incredible effort that the bank has done in responding to the COVID challenge. More than 67 countries have benefited from over $7.5 billion in investments in vaccines, and we are looking for those numbers to go by the bank, and over 200 million more to follow in the coming weeks and months, just to give an order of magnitude. We've seen countries like Ecuador, Ministra Garzón Villalba, felicitaciones, becoming examples globally of such an effort in vaccinating our populations. But with all this effort, we all know that we need to go beyond vaccines. It's not only vaccination that will bring us strong and better out of this COVID pandemic. We are working intensely in pandemic preparedness and response as we look forward. And in that setting of strengthening our capacity to confront future challenges, this wastewater-based epidemiology becomes an extremely interesting alternative for many of our cities and many of our countries. As Jennifer just pointed out, we need to be conscious of other determinants of health, and water and sanitation is probably one of the top and most determinant variables for our health status. And this is, Jennifer, an excellent, I would say, excuse or argument additional to double efforts around access to water and sanitation, with all the advocacy from the health sector that we should always be bringing into the policy discussions. It is also a great element, by the way, to strengthen primary health care and community engagement, which are the backbone for health system strengthening and also for a better response in the future. So it makes all the sense to advance exploring, discussing, hopefully implementing and scaling up alternatives and innovations like this. Professor Manuel has been very frank and open in his presentation, even anticipating where we can find challenges and weaknesses that we would need to mitigate and resolve, advancing such a technology. But as has been said by all the panelists, this is an incredible instrument to anticipate risks, to open our eyes far beyond what we can do being reactive and case-by-case follow-ups, and gaining momentum and time to do evidence-based policies, which will bring so much benefit and also reduce so much impact and cost among our communities, especially the lowest income and most vulnerable of them. So I think we have a great element here to follow, Michele, and all a great example in countries and cities in the region also to follow closely, and a very good element to strengthen national and subnational levels of response, increase cooperation across agencies, and also bring in the private sector to strengthen our capacity to, again, anticipate risks, not only in COVID, in so many other things like antimicrobial resistance, just to give an example of current concern, and again, improve the health system and health outcomes and human development in our countries. So with this, back to you, Josefina, and again, my praise and my thanks to all of the panelists and all of the organizers of such a good session. Over.
Thank you, Juan Pablo. Thank you to all the panelists. Thank you very much for sharing with us this innovative tool to control COVID-19 in our region that has been hit so hard by the pandemic. We would like to encourage you to download the study, Strengthening Public Health Surveillance Through Wastewater Testing, in the website of the World Bank in Latin America and the Caribbean. Good afternoon, and thank you very much.